Stakeholders. With the implementation of any new procedure or policy, many things are necessary. Hard work, dedication, and sacrifice, especially from the stakeholders involved, are critical for implementation and efficiency. For the Agency for Healthcare Research and Quality, stakeholder support, beginning with program design and continuing through the evaluation, is critical to a successful safety and care management program. Stakeholders should be involved during each stage of the program to build support for it, provide suggestions for its design, and participate in the evaluation and continuous quality improvement activities. This scenario's key players are the patients, the staff, and management, among others needed. Patients first need to be educated about their right to autonomy, their right for information, and their right to refuse, and their right to participation. Patients and patients' family are vital in developing and executing a care management plan, and their involvement from the beginning should be acknowledged and encouraged. This way, patients can recognize anything they feel may be out of the ordinary and serve as another pair of eyes in their care. Specific to this case, if the patient were aware of the importance of patient identification and the potential danger it could cause, perhaps he could have been adamant that procedures are followed at all costs. Staff involvement, especially from the nurses, is probably the most crucial role for implementation, as they will be the front runners to the test of change. It will take the nurses' willingness and dedication to testing the new policy to ensure its safety. The medication error in this scenario led to the loss of life, so change is a must. Change in policy, procedure, mindsets, unit cultures, and patient assignment will all require readjustment from the normal processes and need all involved to have faith and accept new ways to work. Nurses must have involvement in every step of the planning process to ensure the unit's workflow remains intact. This will help with nurse involvement and dedication to the process with minimal change necessary. Management's role will also require some finesse, dedication, and willingness to accept change. Managers must support the nurses with their complaints, concerns, and critiques of the new procedures. Their main problem is to ensure a smooth transition, all parts are functioning, and that all parties involved are participating accordingly. Their involvement also covers auditing the processes, noting any changes they feel may be necessary, and keeping order, as it takes time for something new to become a regular part of a unit's workflow. Identifying the patient was not the only misstep in this scenario. Assigning a similar patient in the adjacent room is a safety error on management. Along with the other changes outlined in the plan to do the cycle section, an alert system incorporated in the room assignment process will be an additional deterrent to similar patient demographics and diagnosis. This will also serve as a reminder to place name alert placards on doors and proper identification in the patient's charts. This will take patience, as the time it will take to develop such a program may be extensive and the time it will take to implement may be even longer. There will be many glitches and changes necessary, as anything new requires hard work and dedication to be successful.